Hi, this is Dr. Harris Jensen, and I got an interesting question today from somebody visiting my website. And they asked, what are some things a person can do to help ADHD without using medicines? This was a person who tried a lot of different medicines and just had side effects, headache, insomnia, mood swings, and that can happen. About 10% of people using stimulants get a lot of side effects and just can't use them. So give up on the stimulants, but don't give up on treatment and let ADHD run or ruin your life. There's other things that do work to a degree. It just takes a little more work to implement them. Non-stimulants include medicines like Strattera, but they too can have side effects like daytime drowsiness and weight gain. But not everybody gets those, so they might be worth trying. Still, other people don't want to use medicines, and that's great, but they wonder, what does the evidence show? So I'm going by research I did on openevidence.ai. It's an artificial intelligence platform for doctors, and it searches the world's scientific database. You can do the same thing to a degree on ChatGPT, or you can go to Google Scholar and type in your question and get access to the documents themselves. So what does the evidence show? Does exercise work? Yes. In my experience, for it to work, people need to be exercising intensely for about an hour a day, or it just doesn't work. And so only about 1 out of 100 people are going to really have that intensity to do that, but it can work. What we're looking for are interventions that work, that keep on working, and work in a number of different ways. You want interventions so the patient with the ADHD experiences benefit. Hey, now my grades are going better and my work performance is up. But you want it sustainable, month after month, year after year. So we don't want any quick fixes, because they tend to work and then don't work. And we also want help so that other people can see that difference, right? You want your wife or girlfriend to say, yes, now he's making eye contact and he's listening and repeating back to me what I said, hours or a day later, like he's really paying attention. We want teachers to say, yes, Joey is finishing his homework assignments. We want parents to say, we're not getting that defiant behavior or that resistance to doing chores or resistance to doing homework. And he's fun to be with. Untreated ADHD in young people leads to a lot of adversarial relationships. They don't get along with teachers and parents. It's hard for them to form consistent good friendships in some cases because their mind's wandering all the time. And that can lead to issues in adulthood, such as trouble forming romantic relationships, trouble forming consistent good work habits, and then not doing well in work or relationships. And so we want interventions that work well for the patient and other people, and we want it to be working on an ongoing basis. So what does the research show? Because if you go to Google and type this issue in, all sorts of snake oil salesmen are going to say, hey, I have something, pay me money. And you can search those on Google Scholar to see what really works. So does just seeing a doctor work? No, we're not magic. How about a therapist? Talk about your feelings. Cognitive therapy. No, it doesn't change the behavior of the wandering mind, the impulsivity, and the lack of follow-through. Does behavior therapy work? Because these are behaviors that are the main problem, right? And yes, it does. What kind of behavior therapy? So I and other therapists see this all the time. You teach young people and teens and adults to manage their time. That's a behavior. Write out to-do lists, and there's a good way and a bad way to do it. When are you going to do those items? Then you keep a calendar. You keep that open on your desktop. It follows you like your shadow. Will people just do that if you say no? But it's with repeated follow-up with the doctor or therapist. Then they'll pick up this new habit because they see much more deeply this is going to help them the rest of their life with jobs, with relationships, a rewarding life, you bet. Then there's interpersonal skills. Those are behaviors like making eye contact. Don't look away from the person you're talking to. Face them and pay attention to what people are saying. Follow the thread of conversation and follow up with good questions. With kids in school, I teach them to ask questions to the teacher, write down notes of questions they have during the lecture so they can ask the questions after the lecture. I teach them to be quick to ask for help with a tutor. Write down questions for the tutor, do the homework every week so you go over the homework with that tutor. For young adults in relationships, I recommend they get someone as their wingman or wingwoman who can kind of coach them along. And once again, you're doing your homework, learning your communication skills so you can have a rewarding romantic relationship. So this is behavior therapy. That's what works, and it's with repeated visits, like once a week for 2 or 3 months. And that's what helps for panic, anxiety, and lots of other things. So it's not surprising. What about some other interventions? How about acupuncture? Helps a little bit, but no sustained benefit according to randomized placebo-controlled studies. How about neurofeedback? That's pretty popular. Well, if you compare it with a sham or a placebo neurofeedback experience, they both do about the same. If you think you're doing something, it'll probably make a little difference, but not for very long, and you're back where you started and you wasted your time. Just like with cognitive therapy or supportive therapy, just talk out your feelings, doesn't work. How about mindfulness training? Yes, it does work. Does it work for all 18 symptoms of ADHD? No, it does not. But it helps people become more reflective and calm down their easily frustrated emotions and be more in the moment, like what are people telling you right now, instead of letting your mind wander. So it has some benefit, but it's very minor. However, it can be long-lasting. So that's a plus. Then there's dietary interventions. If you take in more omega-3 fatty acids, one study said that really helps. Yes, it does. So that's pretty cool. Get a nutritional intervention that works. It takes 3 months for it to work, but then it keeps on working. The results are minor, but sustainable, and let's take that. How about getting rid of processed food? No study on that, but I see that help all the time. Processed food, you get rid of the nutrition that the nerves need. Vitamins A through Z, amino acids, antioxidants. Your nerves need all that. Why? They can't store those nutrients, and they need them to make the 200 plus chemicals they use in our brain to send signals. So to use processed food is like putting a low octane gas in your tank and hoping it has acceleration. Good luck. And how about getting rid of food dye? Yes, that does make a difference. It's a minor difference. It takes a while for it to happen. It doesn't happen for everybody, but it happens for many of my patients. And the results are sustainable. And it's easy, just cook your own food. What about nutritional supplements or herbal supplements like ashwagandha or herbal preparations. So you can look them up, but I've done that and I can't see any placebo-controlled study that shows benefits that are sustained for like at least a year. And again, with the placebo effect, just because you think you're doing something, your brain can actually fire up. There is a placebo response area in the brain. It's the anterior nucleus, anterior frontal nucleus. So with these, your brain is physically working differently, but it's not something that's sustained. And so why do we want sustainable benefits? Because you want to get in a relationship and stay in it because you're focused. You want to succeed in school, not just this semester, but throughout your high school or college career. Work. Yeah, you don't want to succeed just this month, but you want it month after month, year after year. And let's be frank, life nowadays in the post-COVID world has a plethora of distractions, from smartphones and video games, TV, and the like. And there's ever more demands on our attention, prolonged attention. We're being asked to focus on our screens for hours and hours every day. Even waitresses and waiters use iPads to take orders. Truck drivers, FedEx and UPS drivers, they have computers watching how fast they're going. Are they stopping at stoplights? Are they staying in the right lane? Are they driving too slow? Are they driving too fast? And so there's ever more demands on our attention. And doctors too. So last week I heard of a doctor in Denver who lost his license. He was prescribing medication for ADHD, and he crossed the line, and the federal government took away his license. So he wasn't paying attention. I don't know exactly what he did, but there's dozens and dozens of regulations on the state and federal level about how medicines need to be prescribed. And so, but this is true for everybody. Even if you're a housewife, doesn't matter what job you're in, housewives have the most important job there is, but you have to focus on, cooking, cleaning, bills, and 100 other things that happen for each one of your kids, to say nothing of taking care of your poor husband when he comes home. And so it's important to be focused. It's important to know what really helps your focus. And I'm putting out this video so you can have a general idea of what works and what doesn't work. Stimulant medicines work, non-stimulant medicines work, behavior therapy and exercise work, eating healthy works, time management such as using to-do lists, a day timer, flow charts, sticky notes, that all works. And that's the big picture of what helps for attention, especially the non-medicine things that help for attention. If you need help with attention, I'm here to help. Just give me a call. And I hope this has been an interesting and informative video with evidence from openevidence.ai. So now doctors have artificial intelligence as something that can help them focus or be distracted by. So take care. Thanks for watching the video.